Hello my friends, welcome to another video here on the channel, and today I'm going to talk about a very important topic, anxiety. And I'm going to give you a recipe for a natural remedy for anxiety and panic attacks. So if you're someone who's anxious, worried, stressed, insomniac, or has a panic attack, this video is for you, right? In today's video, I'm going to talk about two very common disorders, anxiety and panic disorder. Do you know the difference between anxiety and panic disorder? Let me know in the comments if you do. So you'll learn about these and other issues now, as well as learning about a delicious tea for anxiety. So stay with me until the end of this video. Don't forget to subscribe to our channel. Click on the little bell to activate notifications. Leave your like. This like is very important so that YouTube understands that this video is important and sends it to more people. Well, my friends, have you managed to stay calm and focused in this hectic, challenging world? Having to deal with so much, few people manage to balance work, family, and still find a little time for themselves. And in this wheel of life, we end up falling victim to a mental disorder or burnout. These are two disorders with very similar characteristics. Some symptoms are common to both, which leads to some confusion in people. So let's differentiate, shall we? I'll start with anxiety. We all have some degree of anxiety, which in a way spices up our lives. For example, when you're preparing for a party, you're anxious that the party will arrive soon. When you're going to take a job test, it's normal to be anxious. So common things in our lives generate a bit of expectation. Anxiety is also important because it protects us from dangerous situations, because it makes us prepared in case something bad happens. So this kind of anxiety is normal and healthy. It's just that some people can't live in the present moment. They don't focus on the present in the tasks they perform and transform their routine, as if they were constantly living under an eternal threat. It's adrenaline that's present at various times of the day. These people anticipate problems that are far from happening. They often have negative thoughts, are irritable people, and can become obsessive. They are tired because anxiety steals a lot of energy. And despite this tiredness, they can't sleep properly because their brain won't turn off. All of this leads to a huge disruption in the person's life, both personally and professionally. During anxiety attacks, these people feel shortness of breath, palpitations, nausea, dizziness. In addition, anxious people live under the command of adrenaline and cortisol, which is the stress hormone. This deregulates their appetite, deregulates calorie burning, and leads to weight gain. And one of the techniques for controlling anxiety attacks is breathing. It's about taking control and saying to yourself, you who are anxious, keep these phrases, I won't let this happen again. First sentence. Second, this isn't real. Third sentence, I'm not going to give this power over me. Fourth sentence, I am the leader, and know that negative thoughts will appear. And don't fight them. Don't stay, I won't think about it. It's worse, right? It's worse, right? So let the negative thoughts come, because they come and go. My suggestion is that you exercise your breathing frequently. Breathe in for 4 seconds. Hold it for 4 seconds and let it out in 6. Don't wait for the crisis to come. Always do meditation, which will help you a lot with self-knowledge. I want you to imagine everyone here. If all these symptoms I've talked about in the anxiety crisis become more potentiated, become worse, that's when panic disorder starts. So you're saying that panic disorder is a continuation of the anxiety crisis, more or less. They are two disorders that have points in common, right? That's why there's so much confusion. What are the commonalities? They both have rapid breathing, a feeling of breathlessness, palpitation, which is tachycardia. The big difference between an anxiety attack and a panic attack is the duration, the length of the crisis and its intensity. Whereas an anxiety disorder happens in a crescendo, it gets worse slowly. Panic attack suddenly stop. You notice that you're feeling ill. It's as if it comes out of nowhere, to the point where you feel a sharp pain in your chest. I've had countless panic attacks, and mine, whoop, the big panic attacks I had, I felt like I'd had a stroke. My face would get sick. I was sure I was going to die, and it was out of the blue. You don't spend the day suffering. You don't spend the day with a heavy feeling in the back of your head. You don't spend the day in anguish. It's out of the blue. You don't expect it. While anxiety disorder happens in a crescendo, panic comes on suddenly. So there's a temporary detachment from reality in panic. It seems that the person doesn't even recognize what's around them. They just think they're going to die. And this belief in death generates a lot of fear. And the person even changes certain habits so that the crisis doesn't happen again. So panic disorder generates these sensations. And the fear of having it happen again makes you stop doing a lot of things in your day-to-day life. It's also very common for panic sufferers to sweat, trembling, and having their digestive system affected. You may have stomach pains, chest pains, and unregulated bowel and diarrhea. In panic disorder, although all the symptoms occur in a short period of time, it takes the person about half an hour, 5 minutes to half an hour, to get rid of all the adrenaline that has flooded the body. The first crisis can occur at any age. Even children are having them nowadays, but they usually manifest themselves in adolescence or early adulthood. I had my first panic attack when I was 35, and for no apparent reason. And the episode can recur randomly, several times in the same day, and it can take weeks, months, or even years for it to appear again. It can also occur during sleep. It's as if the person was watching a horror or suspense movie, so they already get anxious. And at the moment of the scare, they reach the peak of their anxiety. In other words, in a very short period of time, they reach this peak, which then subsides. This whole process of panic disorder lasts an average of 30 minutes, depending on the case. Anxiety, on the other hand, is continuous, variable, and progressive. So imagine an electrocardiogram graph. There's that rise and fall, right? It's more or less like that. The anxiety crisis can last minutes or even months. You can spend months anxious. Dayan, but what are the causes of panic disorder? Guys, the causes of panic disorder have not yet been perfectly clarified of this disorder, but it's believed that genetic and environmental factors, for example, in my family, I have it, my mother has it, my sisters have it, practically everyone at home has had it, so it has a lot to do with it, right? So environmental factors, if you work, for example, in a company where the climate is bad, the chance of having a panic attack is extremely high. There's a lot of stress. Some people abuse certain medicines like amphetamines, medicine to study, this Venvance business, sibutramine to lose weight. So there are drugs, alcohol itself can be involved in panic attacks. And with regard to the treatment of these disorders, the most common thing is that you go to the psychiatrist and he prescribes anxiolytics, antidepressants, and psychotherapy. I'm not against anxiolytics. I just think you have to be very careful that they don't do to you what they did to me, which was to give me black stripe. So it took me a long time to get rid of the black stripe. And it's very addictive. It's a pain to get off it. But using a red stripe medicine for 3 months can help you a lot, right? And of course, there's nothing better than Ribotril in a crisis. And it's often necessary, right? So now therapy, especially cognitive behavioral therapy, can also help, right? Another strategy that can be used to complement treatment is the use of teas. And I'm going to give you a little recipe, but you need to consult your psychiatrist to find out if any compound, because tea is medicine, can harm the effect of any medicine you're taking, or if it can harm your baby if you're pregnant. So write down the recipe for passion fruit tea. You're going to take 2 passion fruits, 2 well-washed ones, wash them well with soap, brush off the peel, preferably a well-known passion fruit from the farm, and you're going to cut. Put the pulp of the 2 in a pot, cut the peel into small pieces, and boil it in a liter of water along with the pulp. Take a liter of water and pour in. the pulp of the 2 passion fruits with the peel chopped up, okay? It starts to boil. You add 2 tablespoons of chamomile, turn off the heat and leave it on for a few minutes, 5 to 10 minutes. Right? What are you going to do? After 10 minutes, you strain it and drink a cup or a glass. It can also be iced before bed without sweetening. What's left over, you keep in the fridge. If your anxiety is very strong, you can drink it during the day, up to 3 glasses, okay? So it's very simple, folks. So the effectiveness of using passiflora, which is found in passion fruit, for cases of anxiety, menopause, this tea is also good for menopause, body itches, fibromyalgia, insomnia, it's scientifically proven, you know? And this compound has been compared to an antidepressant, including for patients undergoing dental treatment, where the use of passiflora also reduces symptoms of anxiety. As for chamomile, it's one of the most widely used and well-known teas throughout history. Chamomile has been nicknamed the queen of tranquilizers. Scientific studies show that chamomile contains a component called apigenin, which fights free radicals and oxidative stress, reduces generalized anxiety, and improves sleep. So if you suffer from anxiety or panic disorder, know that there are complementary treatments that can help you overcome these disorders. Okay? Hugs to you, live healthy, live with passion, with God in your heart. Thanks, guys. Stay with God. See?